I'd like to introduce the last panelist, Professor Mike Sachs. Mike Sachs is Emeritus Professor at the University of Suffolk and Visiting Professor at the University of Lincoln, the Royal Veterinary College, University of London, and the University of Westminster, United Kingdom, as well as the University of Toronto, Canada. His work spans the social science from political and social policy to his base discipline of sociology. He is a past president of the International Sociological Association Research Committee on Professional Group and is now vice president of ISA Research Committee on Health. So now I would like to introduce, we'd like to welcome Dr. Sachs. Thank you very much.
Thank you, Mawako. I'll just get my slides loaded up. Having a few problems here, just connecting. I don't know whether you might be able to help me to put my slides up. Oh, brilliant. You can, oh, that's fantastic. Thank you so much. Right, excellent. Brilliant. Thank you for that. So I want to talk about the health policy response to COVID-19 in England. And after the effective introduction by Mawako, I don't think we need to linger very much on the next slide. If you could just put me onto the next slide, please. Lovely. I'm just basically reiterate some of the things that Mawako has said. And I just wanted to say that I'm really speaking from a sociological perspective, but I have worked sort of across disciplines all of my life, really, in many ways. If you would just go back to the previous slide, that will be helpful. Basically, I also work with governments, sort of government advisor. I also advise internationally. And if we could go on to the next slide, please, beyond my personal profile. Yeah, so that's my experience. Can we go on to the next slide, please? Thanks. So anyway, so we've heard that the COVID-19 pandemic is sweeping the world. And there are now over 1 million deaths and 34 million cases globally, which is a terrible statistic. Countries have made many different responses to this. And I've been really kind of struck with the difference between what has happened in Vietnam and what has happened in Japan and what is happening in England and the UK generally, because we've really moved to quite a high level of cases here. So we've had hundreds of daily deaths in the first wave and many thousands of cases every day. And we're now into a second wave, which is occurring with over 7,000 positive cases and 60 or more deaths per day just a few days ago. And I'm going to say something about that. And we've switched policy from, herd immunity to full lockdown, which has obviously affected some countries as well. So we've seen all shades of position. Next slide, please. Thanks. So this sort of indicates the kind of entry into the second wave. But what I want to say, which hasn't been mentioned so far, is that there are huge issues about the interpretation of statistics, because although we seem only to have had 6,000 or 7,000 cases back in April and March, the estimate now is that there were in fact 100,000 cases of coronavirus, but they simply weren't recorded because a rigorous testing regime wasn't in position. And so even though now the steady state has moved towards 7,000, we actually are much better off than we were in the first wave in terms of cases. But what I would say is that just today, the government announced that there has been a shortfall in recording the number of cases. And so now the estimate for yesterday's number of cases has leapt up to 23,000, which is just, incredible, really. And so I don't quite know where it's going to go. And so I'm a little bit critical of the government. So I'd like to go to the next slide, please. Thank you. And I just want to say that the government policy has been quite severely criticized in England. And although it may be worse in other situations in terms of policy, as we've heard, for example, maybe in India as well, I think that there was a very late response to the initial wave and a weak response to the second wave of cases. And government personnel weren't always setting a good example. They didn't have action taken against them, including the Prime Minister's top advisor, who had COVID-19 and drove up to the north 200 miles with COVID-19 during lockdown, which wasn't a good idea. We've had delayed and inadequate testing and tracing arrangements. I mean, just recently, it was indicated to me that if I wanted to get a test, I'd need to go drive some 150 or 200 miles to a testing station. And this is 7 months in. We've had insufficient personal protective equipment, including particularly in care homes, where COVID-19 has run wild. We've had poorly monitored and slow implementation of travel restrictions. We heard that they have been very stringent in Vietnam, for example. That's been very far from the case in England. And we've had very confusing advice. Should we wear face masks or should we not? Seem to be more linked to the availability of face masks rather than the science behind it. And there has been orders for people, you know, you've got to get your employees back to work, but given very short notice in terms of introducing COVID-19 safe measures, which is not so good. So next slide, please. So some of the reasons for the poor government response to COVID-19, they're very varied. I mean, some of them are, you know, in any country, you're going to have this left field development where there are going to be unknowns, mistakes are going to be made. It's pretty inevitable. But there have been major supply chain issues as well, particularly in terms of the delivery of PPE, as we call it, from outside England. But the government has been quite desirous to protect individual liberty in a democratic society, and so has been reluctant to actually impose top-down solutions. But there has been a lot of incompetence, which has been evident in the government leadership team, and the government has lost a lot of trust in terms of where it's going. And I think another factor that's come into the equation that hasn't been strongly mentioned is that there is a need to actually balance the fight against COVID-19 with the functioning of the economy, because the dip in the economy can actually cause more serious health issues than COVID-19 itself. And here we're talking in England about a dip in performance, which has probably been much stronger than, you know, than the years going back to the 1920s and the Great Depression. Next slide, please. But from a sociological viewpoint, I think that the effects of government policy on coronavirus has been really manifold. One of the issues has been that obviously because of some of the issues about the speed of getting a grip on COVID-19 and other issues to do with the infrastructure and the equipment issues, where we have seen COVID-19 run wild, there has been greater morbidity and mortality from COVID-19 than strictly necessary. And we need to realize here that we look at deaths as an indicator, but there's some pretty horrific effects, long-term chronic effects from COVID-19, which we should be very aware of. And this is even amongst young people who are least well affected, least badly affected. And we also have seen considerable widening inequalities for the aged as compared with the young, and for particularly Black ethnic minorities, who have been the most adversely affected groups from a health perspective. So we found that certainly in England, there have been a larger proportion of deaths amongst those who have contracted COVID-19 amongst Black ethnic minorities. And of course, the elderly have been disadvantaged in two ways. One has been from having to shield, because the governments have told them essentially to stay at home for the first 6 months to protect themselves, which has obviously led to social deprivation. We've also seen the ramifications of unemployment and precarity, because unemployment and precarity have both risen quite steeply, with all the implications that they carry for ill health. And we've seen a great negative impact on the digitally disadvantaged at all levels of education, schools, colleges, and universities. So those people who don't have PCs or have antiquated PCs are definitely at a major disadvantage in terms of the way the government and institutions have approached this in terms of online learning. And there has also been a tremendous conflict which has occurred between the aged and the younger generation over public health rules. And this has led to some perverse stigmatization of younger people. You know, it hasn't quite been people who are in the front line, who are dealing regularly with COVID, who've been majorly affected. So basically, if we go on to next slide, please. If anything, those who have been at the front line have been feted and lauded by the general public. But I would like to just make one point at the close of this presentation, and that is that the effects that have really been amplified by the government insisting that they're following clinical scientific advice. And in a way, it's appeared to people in England and the UK generally that this is a kind of smokescreen for its own failures. It's kind of passing the buck, because there are intense disagreements among clinical scientists about aspects of the policy. And it really does deflect attention away from the fact that politics has played quite a significant part in setting the policy course, which has not been wonderful for England. And I just want to say too that social scientists were relatively marginalized in the policy process. And this has led to the amplification of some of the debilitating effects of the pandemic through, for example, the lack of awareness of the mental health implications of social isolation, and neglecting the disruption of familial support through social distancing. I was very struck by Zakia's comments originally about domestic violence, and we've seen similar rises in domestic violence, particularly against women in England, which I would highlight. And also, there has been a failure, I think, by some members of the public to understand the more carefree reaction of youth to COVID-19 and to get into a kind of blame culture about unruly behavior, which perhaps, you know, it may not be good for people who are vulnerable, but it is understandable and one can have some empathy. So next and final slide, please. The conclusion, I just wanted to highlight the shortcomings of government health policy in England in relation to COVID-19 and the factors that have shaped it. I've also endeavoured to show the negative social effects that have emerged in consequence of this policy. And finally, I wanted to really underline how important it is to have sociologists and other social scientists, we say, inside the tent, alongside clinical scientists in the health policy formation in response to the pandemic. It's very important that we all work together. And I just have a couple more slides. One is just the references that I've drawn on, amongst others. I would particularly recommend the Michael Calnan article on health policy and controlling COVID-19 in England, which is really excellent. Sociological Insights, which came out relatively recently. And of course, some of the other items which are listed. And just go to the final slide. I just want to thank you very much for listening. It's been a pleasure to be invited, and I hope that I've added another dimension to the mosaic which one can see globally in relation to COVID-19. So thank you very much, and let's look forward to a better world. Thank you.
Thank you very much, Mike Sachs.